Okay, hello friends, myself Dr. Sanjeet Kumar. Today we are going to start organochlorines. These are the organochlorines product classification. It is 4 group: DDT and analog. Examples: DDT and methoxychlor. Benzene hexachloride, this is called linden. Gamma hexachlorobenzene. Cyclodines and related compounds like aldrin, chlordene, dieldrin, endosulfan and endrin. Then fourth group, toxafen and related compound. Then mechanism of action, they interfere with the nerve impulse transmission. CNS is first stimulated and then depresses. It has no effect on the cholinesterase. Selectively bind to open channel sodium channel or activated sodium channel and slow their closing like inactivation, thus allowing the influx of sodium ions. Fatal dose: DDT 30 gram, gamexene 15 gram, chlordene 30 gram. Then endrin, this is polycyclic polychlorinated hydrocarbons, belong to the cyclodines group. It is stereoisomer of dieldrin, not soluble in water. It has bitter taste, also called plant penicillin, because of its broad spectrum activity against the various insect pests. A smell like kerosene, 10 times more toxic than DDT. Commercial preparation of endrin, so Indrex, Endrin WE16, Indox DB50, Endotox EC20. Fatal dose 5 to 6 gram. Fatal period 1 to several hours. Then mechanism of action: selectively bind to the open activated sodium channel and slow their closing inactivation, thus allowing the influx of sodium ions. Then clinical features: hyperesthesia and the paresthesia of the mouth, tongue, face and extremities. Then GIT: salivation, nausea, vomiting, abdominal pain, rarely diarrhea. Respiratory system: coughing, froth from mouth and nostril, dyspnea. CNS: headache, giddiness, restlessness, hyperirritability, dilated pupils, mental confusion, ataxia, incoordination, tremor, convulsion and coma. Cause of death: respiratory failure. Then treatment: ABCD, clothes should be removed, gastric lavage, activated charcoal, cholestyramine, non-absorbable bile acid binding anion exchange resin, which increases the fecal excretion of organochlorines. Dose: 16 gram per day in divided doses for several days. Diazepam, then phenobarbital to control convulsion, calcium gluconate. There is no any specific antidote. Then supportive treatment. Postmortem finding: signs of asphyxia, smell of kerosene from GIT, all internal organs are congested, kerosene smell, signs of asphyxia. It resists putrefaction. Then medical importance: occupational or accidental exposure to endrin, suicidal poisoning very common, homicidal rare, masking its smell by mixing with alcohol, sweets and other food, accidental very rare. Banned organochlorines in India: aldrin, chlordene, dieldrin, endrin, heptachlor, linden and toxafen. Restricted use organochlorines in India: DDT, endosulfan and linden. These are the medical importance. Then something about carbamate: it is derived from the carbonic acid. Examples: LD carb, this is called Temix; aprocarb, this is called Baygon; carbaryl, this is called Sevin; propoxur, this is called Baygon powder. Mechanism of action: it inhibits carboxylic esterase enzyme by carbamylation. Clinical features: carbamate differs from organophosphate by carbamates spontaneously hydrolyzes from the cholinesterase enzymatic site within 24 to 48 hours. Phosphate will not. Carbamate do not effectively penetrate the CNS. As such, CNS toxicity is limited. All other clinical features are similar to organophosphorus poisoning. Then cause of death, respiratory failure. Then treatment, ABCD, gastric lavage, atropine as a specific antidote. Oxymes are contraindicated in carbamate poisoning. Diazepam followed by phenobarbital to control convulsion, supportive treatment. Then important question of organophosphorus poisoning. The most common and most widely used insecticide in India is organophosphate, organochlorines, carbamate, none of the above. Organophosphate is the most commonly used insecticide in India. In organophosphate poisoning, all are due to nicotinic effect except hypertension, the nicotinic action, fasciculation of muscles, this is also nicotinic action, tachycardia, this is also nicotinic action, vomiting is the muscarinic action. So this is wrong. Then regarding mechanism of action of organophosphate poisoning, all are true except accumulation of acetylcholine at the neuromuscular junction. They are powerful acetylcholine stage inhibitors. They act at pre and post ganglionic parasympathetic synapses. They do not inhibit pseudocholinesterase enzyme. This is wrong. In organophosphate poisoning, all are the feature of muscarinic effect except urination is the muscarinic effect, excessive salivation is also muscarinic effect, hypertension is nicotinic action, and diarrhea is muscarinic. So hypertension is the nicotinic action. Usual cause of death in organophosphate poisoning is respiratory failure, neuromuscular failure, cardiovascular collapse, all of the above. Respiratory failure is the most common cause. Shedding of red tears is seen in the poisoning with organochlorine poisoning, aluminum phosphide poisoning, organophosphate poisoning, all of the above. The organophosphate poisoning. Kerosene like smell in organophosphate poisoning is due to presence of alkyl radical, aryl radical, phosphoric residue, aromatic solvent. Aromatic solvent is a reason for kerosene like smell. The most important antidote in organophosphate poisoning is atropine, neostigmine, pyridoxine or diacetyl monoxime. Atropine is the most important antidote. Which of the following is organophosphate compound was used as a terrorist weapon? Malathion, phenethion, sarin, parathion. The sarin is the synthetic form. Complication usually observed on third day with organophosphate poisoning is intermediate syndrome, first to 4 day intermediate syndrome, or delayed syndrome, first to 4 weeks. A aryl group of organophosphate is all except malathion, digenone, folidol, parathion. Malathion is the alkyl group, not aryl group. Organophosphorus compound poisoning is characterized by all except pulmonary edema, pinpoint pupil, constipation, vomiting. Constipation नहीं होता, डायरिया होता है, तो ये गलत है. Important question of organochlorines and carbamate poisoning. Which agriculture poison is popularly known as plant penicillin? Carbaryl, Endrin, malathion, linden. The toxicity rating of insecticides as extremely toxic, highly toxic, etc. is as per Poison Act 1919, Drug Act 1940, Insecticides Rule 1971, Pharmacy Act 1968. Carbamate differ toxicologically from organophosphate. Easily penetrate CNS, so nervous symptoms are prominent. Duration of action is prolonged in carbamate. Carbamates binds to cholinesterase enzyme, inactivating them by phosphorylation. Then carbamates automatically hydrolyzed by the cholinesterase enzyme. 3 क्वेश्चन का आंसर कमेंट में करना है. नेक्स्ट वीडियो में इसका आंसर बताएंगे. दिस इज ऑल अबाउट organochlorines and carbamate. Thank you for watching.